Hello, students. Today we will learn about the scope of biostatistics. The scope of biostatistics in clinical medicine and hospital administrative medical services is broad and essential as it plays a crucial role in both patient care and health system management. How biostatistics contributes in each of these fields. First, in clinical medicine, biostatistical methods are used to compare different measurement techniques. The first one is to compare different measurement techniques like heart rate at the wrist and neck to determine the accuracy of measurement tools. For example, blood pressure instrument, manual and digital meters. To assess the diagnostic test. For example, sensitivity, specificity, and predictive values to determine normal cutoff values of any test. Receiver operating characteristics, log curve analysis to estimate the prognostic modeling. Develop models to predict disease progression and outcome. For administrative medical services, the first one is resources allocation to determine hospital stay and bed occupancy rate. The second one is health information management, analyzing health records and clinical database to monitoring quality indicators like to determine the infection rates, readmissions, morbidity and mortality rates. Patient satisfactions and outcomes. Using surveys and feedbacks data to statistically analyze service quality.
Please subscribe and like our channel and press bell icon for more videos.